Welcome to class, students. Today, we'll be looking at a very vital topic titled Public Health Policy and Systems. Introduction. Public health policy and systems constitute the foundational architecture through which society address collective health challenges and advance population well-being. This comprehensive framework encompasses both the strategic directives that guide health improvement efforts and the operational infrastructure that delivers essential service to communities. Definition of public health. Public health policy. Public health policy represents the formalized decision-making apparatus that establishes priorities, allocates resources, and guides intervention to enhance community health outcomes. This authoritative framework defines strategic priorities, address determinants of health, shape behavioral patterns, target health inequalities, establish accountability mechanism, define strategic priorities through legislation, regulation, guidelines and programmatic initiatives. That's public health system helps to define strategic priorities through the legislation, through regulation, through guidelines and programmatic initiative. Address determinants of health across multiple domains including healthcare, education, environment and socio-economic factors. So it covers both the healthcare, the education, the environment and socio-economic factors. We have shaped behavioral patterns at individual, organizational and societal level through intensive regulation and information campaigns. Target health inequities by directing resources toward vulnerable populations and addressing structural barriers. Establish accountability mechanism for addressing progress towards divine health objectives. Examples of this public health policy and system include tobacco control legislation, nutritional standard for school meals, environmental protection regulation, and healthcare access initiatives. So look at the examples here: smoke-free laws, school lunch programs, public transportation system, disease surveillance, vaccination programs. Smoke-free laws, policies banning smoking in public places, reduce exposure to second-hand smoke, improving public health. Another examples of public health policy and system in action is school lunch program. Public health policies and system working together to provide nutritious meals to students, promoting healthy eating habits and preventing malnutrition. Public transportation system. Public health system can work with transportation agencies to ensure safe and accessible public transportation, promoting physical activity and reducing traffic-related injuries. Disease surveillance. Public health system monitor and track diseases, allowing for early detection and intervention to prevent outbreaks. Vaccination programs. Policies and systems work together to provide access to vaccines, protecting individuals and communities from infectious. So public health operational infrastructure for health delivery. Coordinate diverse stakeholders, execute core functions, maintain surveillance capacity, deliver essential services, and generate and apply evidence. For its operational infrastructure for health delivery, it coordinates diverse stakeholders including the government, agencies, healthcare providers, academic institutions, community organizations and private sector entities. Execute core functions such as health assessment, policy development and service assurance. maintain surveillance capacity for identifying emerging health threats and improving population health status, deliver essential services including preventing care, health education, disease control and emergency response, generate and apply evidence through research, evaluation and continuous quality improvement. The dynamic interrelationship between policy and systems. So policy and systems are interrelated. So we want to be looking at the dynamic interrelationship between them. The effectiveness of public health initiative depends on the scrutinized interaction between policy frameworks and implementation system. Policies provide the strategic vision and authority that enable system to prepare with clear direction, while system provide the practical mechanism and expertise need to translate policies into tangible outcomes. So let's look at it this way. Policy for provide the strategic vision and authority, while system provide the practical mechanism and expertise needed to translate policy into tangible outcome. Together, they create a feedback cycle with implementation experiences from informed policy refinement. This integration promotes adaptive capacity to address emerging health challenges and evolving social contexts. Application across health domains. We have if public health policy and system can be applied to infectious disease control, chronic disease prevention, environmental health protection, maternal and child health, mental health promotion. Infectious disease control through vaccination requirements, surveillance network and outbreak response protocols, while application on chronic disease prevention is via national guidelines, physical activity promotion and tobacco cessation programs. Environmental health protection through pollution control, built environment standard and climate adaptation strategies. Maternal and child health via prenatal care access, nutritional support programs and developmental screening initiative. Mental health promotion through service integration, stigma reduction campaigns and crisis response system. Through this coordinated approach, public health policy and system work collectively to enhance population health outcome, reduce health disparities and build more resilient communities capable of addressing both persistent and emerging health challenges. So core objective of health policy system is healthcare quality and access enhancement, epidemic prevention and infectious disease management, injury prevention and safety promotion, behavioral health optimization, environmental health protection, disaster response and community resilience. So health quality and access enhancement. Strategic initiative ensuring equitable distribution of high quality health service across all demographic groups and geographic region, removing barriers to essential care. Another core objective of health policy system is epidemic prevention and infectious disease management. Proactive surveillance network, immunization program and rapid response mechanism designed to identify, contain and mitigate communicable disease threats before widespread transmission occurs. Injury prevention and safety promotion. Systematic approaches to reducing unintentional harm through safety regulation, public education, environmental modification and targeted intervention for high risk activities. Behavioral health optimization, multifaceted strategies encouraging positive health behaviours through education, incentive structure, supportive environment and intervention addressing substance use, nutrition, physical activity and mental well-being. Environmental health protection, regulatory framework and monitoring systems safeguarding population from environmental hazards including air and water contamination, toxic substance exposure and climate-related health threats. Disaster response and community resilience, coordinated system for emergency preparedness, immediate crisis intervention and long-term recovery support, ensuring communities can withstand and rebuild after natural disasters and public health emergencies. Thank you for listening.